Bruce, are you able to hear everyone all right?
Yes, I am, so far.
Okay, good. All right. We've got Bruce online, and at least from what I see around the table, we've got a quorum. So we'll move things along. Everyone hopefully had a chance to review the minutes from the May 13th meeting that were emailed out. Does anyone have any corrections, deletions, or additions?
Nope.
With that, I will take a motion to approve as emailed.
Also move.
I have a second.
Second.
Because Bruce is virtual, we'll need to do a roll call vote for that. So please just state your name and if you approve.
Okay.
Deborah, we'll start with you.
Deborah Campbell, I approve.
David Harden, I approve.
Larry Caskey, I approve.
Mr. Anderson, I approve.
Brian Cobb, I approve.
All right.
Bruce Dillon, I approve.
All right, minutes have been approved. I don't see any unfamiliar faces. Wishes to be? Oh, any wishes to be heard? All right, we'll move right along into unfinished business.
Oh, the
Infectious
infectious
disease
disease. Yeah, we
updates,
switched it from COVID updates. So, you know, it's now got a new catchy title. Yeah, I was telling Debbie over here, I will keep it very brief tonight because things are good. Yeah, so when things are good, I won't elaborate too much. But yeah, Hendricks County's for COVID is reporting about a case a day at this point. Thankfully, our last COVID death's about 5 months ago at this point, so nobody in the hospital with either COVID, flu, or RSV. Wastewater levels are quite low for COVID. We're beyond flu season at this point. I was telling Debbie last year's flu season was pretty bad. I mean, we had 12 deaths in Hendricks County. That's the most we've had since I've been health officer over the last 10 years. So we will hope for a much better flu season this upcoming year. But yeah, that's other than that kind of historical bit of data at this point. That's really all I have. I think right now we're just enjoying summer and breathing fresh air. So
Yes.
yeah.
Can we add to the infectious disease update?
Oh yes. Go for
We
it.
just heard that Putnam County has a case of measles.
Oh wow, brand new. Okay.
So
All
a
right.
little closer to home.
A little closer.
Do you know if it was an unvaccinated, is it a child or?
They didn't state, they
didn't
just
say.
said it was low risk at this point, and that's pretty much all that I saw at least.
It's on their, they posted it on their Facebook account, so there was a message from the Putnam County Health Officer, so.
Okay.
It just hit.
Keep that on.
Yeah,
Definitely keep that on.
it just hit it like 2 hours ago.
Yeah. I was gonna say I haven't checked the. It wasn't even on the. Breaking news. It wasn't on the state website this morning. So yeah, breaking news.
Hmm.
So we'll keep our radar up.
Closer to home. Lisa, I think you see you hiding back there. Anything on ordinance updates?
Yeah, so we took our food ordinance to the commissioners. The first meeting we took, I think, was June 10th, and the commissioners heard that ordinance. They were pretty positive about it. They only had a couple questions as far as the temporary permits, temporary farmers market and mobile permits. We were asking that they have to submit those applications a week in advance. If it's less than a week in advance, there's a $25 late fee, and then if it's less than 48 hours in advance, we could deny the application. They were fine with that. They even kind of had the same comment that you all did as well as $25 enough of a late fee. And we said, well, for now, I think we're gonna try that. I explained that we would use the rest of this year as education towards those vendors, so we wouldn't be enforcing that immediately. They set a public hearing that was today, and there was no one that had any questions or concerns, so they passed it today, this morning. So
Great.
Very good.
Moving right along. Krista, updates on the budget requests?
Yes, so we submitted our Health First Indiana budget for 2026 to the Indiana Department of Health. And then also submitted our 2026 budget request to the county council. We submitted both the wages and the other account items. Those were the two documents forwarded to you today. We did have a reduction in the total number of wages that we're requesting because of recent changes. So that's $238,952 less in personnel costs. We do have our council budget workshop hearing on August 6th. So that's when the council will have opportunity to ask us questions about our budget. I'll talk more, I think there's another item about, well, the next one is about legislative effects, so I can go into more depth about that. But if there's any general questions about the budget, I'm happy to answer those.
Any questions? What you've seen so far, what Chris has explained? All right. Krista, keep us moving right into new business.
All right, so the Health First Indiana legislative effects. As we discussed somewhat our last meeting, we're not going to fill all of the positions that we had initially proposed for Health First Indiana plan. And we had mentioned having a self-imposed hiring freeze on our grant positions. In time, we have, we're down 5 positions. We have a nurse, an administrative assistant, environmental health specialist, and a family support specialist that all left, and we're not filling those positions. And then we didn't hire one of our seasonal positions this year. So we currently have 32 positions as you look at the org chart, 33 staff because the seasonal is actually 2 people this year. We have looked at our carryover from 2024, so the amount of money that we had left over, and I have a kind of sort of plan about what that's going to look like. As we get feedback from our budget request, we will be able to finalize that. But currently we have one of our public health nurses utilizing those carryover funds to fund that position. Then we could fund one additional. We're waiting to see just kind of the feedback from council on which one that may be. If we can hire one more of those folks that we haven't filled those positions back, or if we need to fill in somewhere else. Some of that carryover is going towards community awards that have already been awarded, so in the first 3 rounds. So some of that's being used for those that we're paying out currently this year. And then we do have some money to add to the pot of money available for community award applications. So currently we could have up to about $500,000 from the carryover, and then we have $156,000 budgeted for next year. So that's kind of what we're looking at as far as the amount of money we have available for community awards. I think that's basically it. Any questions or suggestions?
I guess if you communicated to some of the partners that got awards last year that we may see a shorter time horizon on funding than what we were originally hoping for.
We haven't specifically reached out to them because we have money set aside for everything that was in their application.
Sure.
So what they had applied for, we did make it clear when they applied for it, we couldn't guarantee that this would continue. And that was part of the discussion that we had with partners, is that this should be an initial startup, but they should have a sustainable plan for moving forward, that this wouldn't be a long-term solution. So we have had general conversations like at partnership meetings with partners about where Health First Indiana stands, so I don't think it's a surprise, but we haven't had a very targeted conversation with each of those partners, other than the initial conversation that we had.
Any other questions? All right. The MOU with the local fire departments for sharing of equipment. So hopefully everybody had a chance to look at this as it was emailed out.
So yes, this is an MOU that was drafted by Jeff Porter, preparedness coordinator, and working with local fire departments to be able to share some of our equipment. Mostly was purchased with COVID and other grant funds for preparedness needs. We want to make sure that it's utilized to the full extent, so we've put this MOU together. Eric did review it, commissioners did approve it. We have one signed contract back from Pittsburgh Fire, and they utilized some of our LED signs during their July 4th festivities that they had.
I'm assuming you're just sharing this with us, so we don't need a vote for approval on that, do we? Eric, you didn't think? Okay.
What kind of term? It says the terms from date to date. Have you decided, is it a yearly thing that you do, or is this gonna be from?
The one that we signed, I believe, was like 2.5 years. I didn't bring it with me. I think we had initially thought about 2 years, but we put in the rest of this year, so it was basically through the end of 2027 is the one that we signed. And of course, it's no guarantee, so if for some reason we no longer have the equipment, then it's not available. Or if we need it first, we get first dibs. So we think it's worded, well, that we can share if available, but.
Yeah, I think that's fair.
So can I ask, just practically from my brain, what does that look like? Natural disaster, they just kind of come and, we need your tent, we need your trailer, and they just
Yeah,
kind of take
so-
and run?
Probably, it'd probably be a more localized, if it was a national disaster, we may need those things for whatever we were dealing with if we were involved. Examples of some things, we've had one municipality want to use the inflatable shelter for like public safety days. Or if they have a search, they have a missing child, they're doing search, or an elderly person or whatever, they're doing a search, they can utilize some of that equipment to mobilize for volunteer organization. Some other examples.
Well, it is mostly the shelter they want to use, or like a command center, in the events she's talking about. And then a lot of our signage, Jeff's got the LED signs, things like that.
Okay, big stuff. So
Yeah.
they wouldn't come take all your Band-Aids, we need all those.
No, none of that.
We'll give them back
It's
later.
that big equipment that we got, for the COVID clinics and that type of thing that we can utilize for other needs.
Thank you.
We'll go ahead and move into updates if there aren't any other questions. Lisa, you're back up.
Yes, I really don't have much of an update. Our inspectors have been still working hard on educating all of our operators on the new food code. Our operators have lots of questions, even though an email was sent out to them. We've also been very busy inspecting all of the temporaries. Have lots of events, 4th of July and Road Fest, and every town has to have an event. So that's been keeping us really busy. And the only other thing is, so I had reported that one of the only House bills that we were looking at, or that passed, was House Bill 1577, which was the statewide mobile bill. I am going to be on the work group for that, representing our congressional district. So first meeting is August 11th.
Kristen.
Right, we ventured into vector control in septic season, so we are continuing to trap mosquitoes. The state increased the numbers of mosquitoes needed to submit from 10 to 20. We're getting like 17, 18 mosquitoes, so not enough to quite send off yet, so we're still working on our formula and our trapping locations. But we are continuing to set those. Currently have an open on-site wastewater inspector position. She moved to Minnesota and she's doing great. Now I have an open position and we are interviewing first rounds later this week. So we'll see. I'm also working on updating our registered installer list that we provide on our website and in the office to be more in line with our septic ordinance that was passed last fall. To get that updated. A lot of those installers on that list haven't worked in Hendricks County in a while, so we're getting it more up to date. And then our seasonal technicians this year are doing a great job with pool inspections and keeping those properly inspected. So I don't have much either. Oh, it's very wet for septics. Only 3 have gone in this whole season so far. So, and it keeps raining. So it's going to be a very busy fall for us. So that's all right.
Any other questions? Leanna? Health and
Yep.
Families.
So we lost a staff in April. We won't rehire for a position. So we've kind of adjusted to that. We're seeing about 30 referrals a month. We can only offer services to about 3 to 5 of those, just because caseloads are staying pretty high. So we're not getting through a lot of our referrals, but we are able to hopefully get them out to other agencies if we can't serve them. We did run out of our interpreter services money, but we had some money. DCS is starting to let us use rollover. We've never done that before. They've held on to some money that was allocated for other things. They were able to reallocate it, so we now have enough money to cover. We're only seeing 2 to 3 families a month that we need to use interpreters for, but it goes fast. So luckily we were able to get some funds for that together. Other than that, we are just kind of adjusting. We're still on pace to bring down all of our grant dollars that we will have through September. So our new cycle will start October 1st. And this will be the last year of our contract extension. So DCS should also be putting out our RFPs. Their goal was in the fall. They want to have a full year, close to a year. It won't be a year, I guess it'll be like 6 to 9 months, just because their legal is really bogged down. So it's going to take a while to get contracts going. So all the communication that we've had is that they'll put them out for the state sometime in the fall. So we'll be looking forward to that, but otherwise we're doing fine. But it has been hard to recover from losing a whole caseload. We're just serving less families than we had planned, but we're staying full.
Any questions? All right. Moving on, Nicole.
Our nurses attended the public health nurse conference the end of June, and Susan presented about our STI clinic at that conference, so that was really nice. And then Dan, Krista, and I have been working with MD Wise to do a Back on Track event that will be in September. It's under the dates to remember, but we plan to have immunizations at that as well. We held our last community clinic with IIC on June 18th at the Maid Center, and we'll host our next one with them on October 7th. And then staff have toured the pharmacies at Hendricks Regional and IU West because there are backup for storage of vaccine if there's an emergency. So we went to see where they had space for us. They don't have a lot of space, so hopefully our generator holds tight. And then we've been working on strategies with Dr. Stoppards to increase immunization rates. So we've looked at increasing our advisory board for immunization. So we added 5 new members. Michael and the outreach team worked with us to create a postcard for a resource for health insurance and health providers for patients. And then Danielle is working on a bookmark for us for immunization schedule for like new moms or pregnant moms. And then we are hosting an A to Z training for providers on immunizations in August. So if you know any providers that want to learn about immunizations, they can come to the training in August.
Questions for Nicole? All right, moving on, Ann, you're up.
So this is busy time for outreach. On June 10th, we participated and had a booth at Danville's. It's their new national night out, isn't it? Yeah,
what would they call it?
Normally their National Night Out Against Crime is either in August or in October, and Danville kind of moved theirs up because they're always on the same night and we have to split people to go 100 different places, and this worked out really well. So we were there, and then a few days later, we did Public Safety Day at Plainfield. And a lot of people stopped at our booth, so that was good. We also did Hendricks Pride on the 28th, saw Debbie. So that was a really good event. A lot of people stopped and asked us questions, so that was a good day. Olivia, my fatality review educator, she went to Washington DC for the APHA Policy and Action Institute. So APHA had a policy conference, and it was all about health policy. I think she learned a lot about how legislation works and policy and that kind of stuff. Our diaper pantry in May and June gave out a total of 1,494 diapers. And I think I probably had that much come in the last week or two from, in donations from the Danville Christian Church. And I met with their pastor today. I think we're gonna try to, work with them, promoting some things, so that was really good. And other than that, we're just preparing for fair next week. We'll be out there all week long. So stop and see us. I usually see you.
I'll be there.
All right. Any questions for Ann on outreach? Okay, just keep on clicking along. Krista?
In addition to Erin Lee, we did have 2 others who moved on and no longer at the health department. So we currently have an open position for our food secretary. That just closed, and we'll start calling set up interviews here soon. And then the environmental health specialist for Lead and Healthy Homes, we're not going to fill that position. That's one of those that was mentioned. So with that being said, we do have multiple staff that have been covering more than one job right now. So just want to let you know, especially in the busy season of the summer. So just want to thank everybody for their commitment and expertise and patience as we work through this. The next round of community awards is August 15th, and those will be heard by our advisory team at the September meeting. And we are working with local media companies to help address some of our marketing needs, help us with some videos, and we've spoken with a radio outlet about if there's any opportunities there that they can help us out. So, that's about it for me.
Questions for Krista? This keeps moving. Drew's gonna be upset.
You're on
Yeah.
fire.
Yeah, all right. Dr. Stoppridge then.
Yeah, it started with a hard gavel
Take
smack.
it away with the
Yeah,
officer update.
not a whole lot. I think you've heard I've had a small role in many of the things that we've discussed. I love that we are so busy in the outreach department. Most of the health department knows that I am all for advertising, so I think we got to get the wonderful things that these people do out in the community and make them knowledgeable of those things, our services and our resource guide, and on and on and on. So yeah, I love that our outreach team is going out to all these events. I know it's a lot of work. I know it's a lot of hours, but yeah, it's so important to get our face out there. So thank you for that. And then I will let you know how it goes. But next Monday, we're going in front of Chase Cotton, and some of the leadership from HRH and myself are going to be helping to host a kind of a showing at the local cinema here in Danville, kind of a short movie on kind of how a community came together to kind of tackle issues around mental health. We're going to hopefully show it to a lot of school leaders and community leaders. We'll see how many people we get there. I'm going to share some of the mental health data from our kind of some suicide data from coroner, and what I've been picking off the death certificates, and giving a brief presentation that night. and hopefully we'll come up with some discussion and maybe some strategy to how to attack mental health. I think we're just looking at the data. I'll share more with you next time. I'm still kind of in the process of putting it together, but I can tell you mental health issues for like people from like teens and 20s, like at least 2 times more deadly than car accidents or anything like that. Yeah. So we all hear about seatbelts and don't drink when you drive. Well, we are really kind of missing the boat on gunshot wounds and suicides and that kind of stuff. So, but anyways, I'll finish that presentation. I might share a few of the high points from that next time I see you all. But yeah, so that's been taking a little of my time here the last week or two getting that put together. Other than that, these people do great work. So I always love working with them. So.
What is the name of the film?
Oh boy,
Paper Tiger.
There you go. There you go.
Paper Tiger.
Paper Tigers.
Yeah, I was trying to find it on my phone, but yeah.
Now, is the idea just to kind of elevate awareness with this and then start the discussion from there?
Yeah, I think so. I think that's kind of step one, is just to try to ultimately what we are, one of our big pushes is if we can get school leadership involved. Once again, we'll see who all comes to this. But yeah, we would love to change some school policies around mental health. For example, vaping suspension just has them vape at home, right? So if we can have them have some kind of required rehabilitation effort where we can hopefully help them to quit vaping, so those kinds of policies are probably better for the students, and not all schools follow those kinds of ideas. So, but that's just one example. But yeah, I mean, more social worker, maybe we can talk people into budgeting more towards mental health. But yeah, we're trying to get the right people in there to hopefully make some pretty big changes. So.
Rather than have everything end up with the school resource officers.
Yeah.
All right. Any other questions for Dr. Stockbridge? All right, just tick off some days to remember here, the Tox Away days, and I promoted these at the Hendricks County Farm Bureau's board meeting last night. They were trying to think of similar things. So July 12th at Hickory Elementary in Avon, Tire Amnesty on August 9th at the fairgrounds, and then another Tox Away on August 16th at the fairgrounds. Then Ann already talked about that we would have the outreach table at the 4-H fair next week. That's hard to believe that's already here. July 24th, Night Out Against Crime in Avon. Then all the way into September, Thursday, September 11th, Indy-wide vaccine fair at the fairgrounds. And then, I missed it, the last Tox Away day at Hummel Park in Plainfield on the 18th of October. Any other dates, Krista, that we didn't make the list that we ought to be aware of? Okay. Larry wasn't able to join us today, but I would say, with the discussion that we had with him last time, I think, if we can work with advertising and public media ahead of that August date, any awareness for the rest of the council members that aren't aware of all the great things that we do here, if they see it out in the community, that'd be great. So I'll kick it over to Eric for comments from our attorney.
Excuse me. One of the issues that we need to address in the near future would be Bruce's replacement. I can't remember who Bruce is officially appointed by.
I believe the commissioners.
Okay. So under that statute, we had that little kind of spreadsheet last time, and the statute says that the commissioners appoint 5 people knowledgeable in clinical and public health, with at least one of whom is a physician. The other appointees, then it says may be any of the following, and then it lists the physician, the nurse, pharmacist, dentist, hospital administrator, social worker, attorney with health expertise in health matters, school superintendent, vet, PE, environmental scientist, PA, and then a public health professional, including an epidemiologist. So the general reading of that to me would say they're supposed to be one of those A through M, but there is, I mean, if the commissioners and the board want to do, I mean, it does say maybe any of the following, so there is an argument to state that it does not have to be from that list. But it clearly says they have to be knowledgeable in clinical and public health. But there is at least an argument you could say that they don't have to be in the A through M, because it does not say shall. So, because when we talked about this with Bruce initially, he did not meet the professional engineer anymore because he was retired. And so we were generally looking at a general appointment if we had to do if we said it had to be under all those. And then I was asking Brian during the meeting what his specific position would be, because everyone else meets those definitions, I guess, except maybe, are you a retired nurse right now, or are you?
But I still hold my license.
Okay, so you would still be valid. So that's really what we're looking at is David and Brian in terms of,
Am I the one that's appointed by the council?
Yes.
Yes.
I did pull up my notes. Yes, Mr. Harden was appointed by the council. And then Dr. Caskey was the recommendation from the town of the commissioners.
Right. So one person can just be general public. That's through the council. And then the others have to have the knowledge in clinical and public health. So if the commissioners and the board both feel that the may is not a shall, which it's not, then I don't think it would require that they have to be from those positions, but they would have to be knowledgeable. I guess, yeah, they'd have to be knowledgeable in clinical and public health, because that is what the requirement for the commissioners' appointments are. So we do have to address making a recommendation, at least for the commissioners would like a recommendation, if possible, for Bruce's replacement. So that was the main issue.
I guess what's our next step here? I'm
So
sorry.
Bruce said he was
Yeah.
done after the September meeting.
Yeah.
So I emailed the county, Todd, and he said, yes, they would appreciate a recommendation if we had one. So,
Yeah, I need to make a phone call of someone that may be interested, so I'm not quite there yet, but yeah. But should I just email Todd if that person is? And we can obviously copy you if,
yeah, I mean,
would that be our next step there?
yes, because it's ultimately going to be the commissioner's position, but they were interested in hearing what the board thought. So.
Yeah.
So the commissioners didn't have preconceived notion of someone.
That was not communicated to me, so. I think it was not on their radar, actually, so.
And do we need to figure about the shall, or is that just?
I mean,
the
I
way
think
we're
that would be a
doing it?
question that, if the board does not feel that that's a requirement, that it comes from those A through M's, but has to be clinical and public health, then I think then it would be up to the commissioners for them to interpret if they feel it's a shall. I mean, their legal counsel should probably know what the general intention, I guess, of that statute was. So.
I mean, to me, I think it's up to the individual. I mean, if we find somebody that fits the bill, is qualified, and is not in one of those A through M or whatever, however many categories they are, but they are knowledgeable, and then I would not have a problem with that at all. Or you could find somebody in that category that past history of things wouldn't be a good fit for whatever reason, so.
Right now, it's like May.
It says May, so Plainfield, the municipality, to me, is clear that it's, because it says, for the municipality, one person appointed by county executive from a list of 3 recommendations by the executive of the most populous municipality in the county of individuals described in 1C through 1M. So to me, it's clear for Plainfield that they had to go C through M. But I'm not, I wouldn't sit there and say that it says it has to be, it's a may. The clean way is obviously if they are. But if we, I would say that, both Ryan and David have knowledge in clinical and public health. So would we say they're not qualified because they're not A through M?
That was that. I think they picked up a lot of public health through the last many, many years that they've been here, so.
So yeah, that's the only thing that needs to, obviously we don't need anybody in place until November.
Yeah.
So we have some time, but
It may be cleaner in January. I mean, if we just run with 6 for a quorum for one meeting, that was kind of our thought, just to start with a new term. The person I'm calling is an engineer if they end up, so they would be on the A through whatever, M, or, so it would not be a question for the new person if they are interested, but I just have a name, I need to make a phone call and talk to them.
they could start potentially in September, even hypothetically, and just finish Bruce's term up, and then assuming that the commissioners would likely reappoint that person starting for January. But also, I could wait as well. That was it.
I think we all know that it's gonna be extremely hard to replace Bruce.
Yeah. Are you in town next meeting, Bruce?
No, I'm still in Jacksonville.
You're still in Jacksonville?
Yeah, I'll be back in Indiana in a couple of days.
Will you be back for the September meeting? You'll be back?
Yeah, I will be there for the September. I'm going to be back in Indiana until Tri-West gets eliminated in the football.
Okay. Well, hopefully that's not September. Yeah. All right. Well, we just wanted to, give you a nice, at least a nice handshake or something. We get it in person. So.
You're not.
Awesome.
Some expired COVID tests.
Yeah, exactly. For the memories.
Future turning gift.
All right, so we're gonna see if Dr. Stoppridge's phone call pans out to anything. And I would encourage the rest of you to scroll through your data banks and see if any of your contacts might fit A through M or even C through M. So we have a backup just in case. Eric, anything else? Any enforcement actions or anything we need to worry about?
I don't think so.
Okay.
It wasn't on my list.
Good, let's keep it that way. All right.
Krista and I and Dr. Stoppridge, we're gonna try to just have like a standing meeting every other month, or we'll see if it needs to even be that often, just to kind of run through and make sure things don't get like dropped between the meeting and the meeting, so.
Good idea.
We started that in June.
Good. Anything else for the good of the order? With that, I'll entertain a motion to adjourn. All right. Fine. Yeah, thank you.
Drew would be
Good
proud.
meeting.